I'm very excited to be back for the 65th Congress in person in Chicago. It's wonderful to see so many familiar faces, some people that I haven't been able to hug in about 2.5 years. Feels really great. And it's great to also meet some of our first-time attendees. Welcome to your first Congress. Thank you all for joining us for what promises to be a very meaningful week for all of you. This gathering has always been a unique opportunity to connect with our peers from across the country and to bring back what we learned to our teams back at home to advance healthcare. We've worked to offer you a wide variety of the presentations which offer something of value to everyone, from early careerists to seasoned CEOs, to veterans, to newcomers. There is so much more information, insight, education, and celebration to come. I hope you wore comfortable shoes. I know I didn't. Seeing you all here today, it is so hard to believe that the past 3 years have happened. It's also hard to believe all that has happened in those 3 years. But I stand with the entire world in my deepest gratitude for all of you and the medical professionals who committed themselves to the well-being of their communities, despite the pain, despite the hardship they suffered. And I would especially like to acknowledge those caregivers who made the ultimate sacrifice so others had the ability to live another day, another week, another month, another lifetime. Please join me in a moment of silence. Thank you. Those dark days also clearly illustrated the vital importance of leadership. I applaud every healthcare leader who made the tough decisions, pulled their teams together, helped guide them through unprecedented times. What a crisis in this country. They proved how leading with empathy is not a sign of weakness. It is critical to the viability and the resilience of our teams. In the middle of the pandemic, while visiting a COVID ICU, a critical care nurse that I met, his name was Paul, he had just lost his house to a wildfire. He was taking care of patients. It literally had happened 2 days before. And I asked Paul, why are you here? It's okay. You can be at home. You can be with your family. He said, I am with my family. This is what I'm called to do. This is how I'm going to heal. Remarkably, his words illustrate the amazing amount of loyalty, fortitude, and resilience that our nurses quietly carry within. And as leaders, these are the people we need to support, care for, and learn from. They need us now more than ever. I am so grateful for what that nurse and all of our caregivers have done to treat and care for all of those suffering over the past 2 years. I can't imagine what we would have done without them, and I can't imagine what we would have done without all of you. But while the global healthcare community continues to see constant changes from COVID-19, there are those on the other side of the world who are dealing with life and death issues on an hourly basis. I hold them in the highest regard, our colleagues who are caring for patients under extreme and dangerous circumstances. You are my hero. This fearful conflict and deadly pandemic has made me realize how truly fortunate I am to be surrounded and supported by so many amazing people. My hardworking team at Kaiser Permanente, my loving family at home, and my conscientious and industrious fellow members of the College of American College of Healthcare Executives. Consider this a shout out to all of our ACHE chapter leaders and volunteers who work so diligently in your busy professional lives to also assess and respond to the needs of leaders on the ground, while ensuring that your feedback came to the ACHE Board of Governors so we heard and changed directions. I've been so honored to serve as your 2021 chair of the American College of Healthcare Executives Board of Governors. During my tenure, I've seen the field come together to meet incredible challenges, overcome those obstacles, and drive for remarkable achievements.